Sunday Live right here at Citizen Television. We got a bit of news now to go on COVID-19. Now, the government is getting increasingly concerned about local transmission of COVID-19 in the country. Health Cabinet Assistant Secretary Dr. Mwangangi says 44%, nearly half, of all infections are locally transmitted, warning Kenyans against flouting curfew hours and unveiling some punitive measures that appear targeted at dealing with the growing problem. Let's get more from our very own Stephen Leto.
The government now says the increasing numbers of COVID-19 in the country is attributed to local transmission. According to the Ministry of Health, 56% of all infections are imported cases, while 44% originated from local transmission.
In the last few days, the very few cases are emanating from our regional quarantine centers. Therefore, fellow Kenyans, we are now worried about local transmission.
8 more cases recorded today, raising the numbers to 270.
7 are Kenyans and 1 is a foreign national. And none of these cases has a history of travel. 3 emanated from our quarantine centers and 5 were picked by our surveillance teams from various parts of the country.
Government now keeping Mombasa under scrutiny. The coastal hub continues to record more COVID-19 cases. Nyali in Mombasa has been identified as a hotspot, with almost all estates in the coastal town recording more than 1 case. Nyali leads with 11 positive cases, while Mvita and Kisauni recording 7 cases each. Changamwe has 1 case, Bamburi has 2 cases, Beach Road, Mamba Village, Kongowea, Mogadishu, Twiga Road and Umoja, each recording 1 positive case of COVID-19 in Mombasa. All the cases having their own contacts that the surveillance teams are tracing. Targeted mass testing has already begun in Mombasa, with the government compiling more clusters for mass testing. Kenyatta National Hospital, as well as the Moi Teaching and Referral Hospital in Eldoret, have joined to boost the testing capabilities as government gradually begins testing of masses.
The MTRCH tests cover a scope of 22 counties, and this will enable transfer of samples from those countries, reducing the turnaround time.
The government has further unveiled more punitive measures, and anyone found outside during the curfew hours will have to contend with the consequences.
All those who break the curfew rules will be assumed to have been in contact with suspected cases and hence will be quarantined for a period of 14 days.
Wines and spirits have been warned against turning their joints into drinking zones, while the government moves in to make good use of the Nyumba Kumi and other structures to deploy community policing meant to nab such individuals to cut the transmission chain in estates. Unscrupulous businessmen have been recycling surgical masks for resale to unsuspecting Kenyans, exposing them to risk of infections.
In particular, we've noticed the recycling of the surgical masks, and we've seen different pictures in social media. And we therefore say that this is unacceptable and this is actually criminal.
The government now says anyone found will be arrested and charged. To fill the shortage gap, Trade and Industrialization Cabinet Secretary Betty Minor says the government has boosted capacity to produce at least 1.5 million PPEs a day.
We have certified 9 government institutions for the manufacture of PPEs, and 34 private institutions have also applied and have received certification.
More personal protective equipment will also be produced for the frontline workers. The government maintains that it is working hard to ensure that it controls the surging numbers of COVID-19 in the country, while at the same time urging Kenyans to follow the Ministry of Health protocols. Stephen Leto, Citizen TV, Nairobi.